Welcome to this educational recording on the topic of applying the model for improvement to improve assessment of orthostatic blood pressure. The Catch-a-Roll Falls program is supported by the Nebraska Department of Health and Human Services, Office of Rural Health, through the Medicare Rural Hospital Flexibility Program. The content of this presentation is solely the responsibility of the presenters and does not necessarily represent the views of our funding source. The Catch-a-Roll Falls program is led by myself, Vicki Kennel, and my colleague, John Veneba. We are both faculty in the College of Allied Health Professions at the University of Nebraska Medical Center. I am an industrial organizational psychologist with expertise in quality improvement and organizational science, and Dawn is a physical therapist and brings the clinical perspective of fall risk reduction to our team. The educational objectives for this educational recording are to describe the model for improvement, to create an aim statement for your efforts to improve assessment of orthostatic blood pressure, establish outcome process and/or balancing measures for your efforts to improve assessment of orthostatic blood pressure, and to identify specific changes or changes to test to improve assessment of orthostatic blood pressure in your clinic. The model for improvement was developed by Associates in Process Improvement and is the improvement model that's widely promoted by the Institute for Healthcare Improvement. The model for improvement is based on three fundamental questions that can be addressed in any order, though we typically need to answer the first question first in order to set the direction for our work. The first question is, what are we trying to accomplish? This entails generating an understanding of the problem or the issue that we want to improve. So in this specific case, as it relates to assessment of orthostatic blood pressure, and setting an aim or a goal for improvement. The second question is, how will we know that a change is an improvement? This requires identifying the data and the measures that we need to gather to help us understand if the changes that we implement actually lead to improvement. And the third question is, what change can we make that will result in improvement? While all improvement requires change, not all changes will necessarily lead to improvement. We need to identify and select changes that we anticipate will address the problem and will help us achieve our aim. We will discuss each of these three questions in further detail in this presentation and discuss them in the context of assessment of orthostatic blood pressure. The Plan, Do, Study, Act cycle will be covered in detail in a separate presentation. Once the specific problem or issue that you want to address has been identified, so in this case, we'll be talking about this as it relates to the assessment of orthostatic blood pressure, your team can establish an aim statement to guide your improvement efforts. An aim statement is a clear summary statement of what your team hopes to achieve in a measurable way over a specific amount of time, which includes the magnitude of the change that you hope to achieve. This statement serves as an overarching guide for your work, and importantly, it helps to establish what success looks like for your improvement efforts. A clear aim statement can help to keep the project on track, provide some general guidance on the processes that you might try to explore, the measures and the metrics that we should identify, and where you want to focus your efforts. To help you with the creation of an aim statement for your efforts to improve assessment of orthostatic blood pressure, we wanted to share with you a couple of example formulas for drafting an aim statement. Those are presented on this slide. You may consider adding the what, so what changes you intend to make to help achieve this aim at a later time if those aren't yet finalized at the time that your team decides to establish an aim. And those changes may certainly be things that change over time as your work evolves. We've created an example aim statement for assessment of orthostatic blood pressure for reference as you create your own aim statement for these efforts to improve assessment of orthostatic blood pressure in your clinic. This simply serves as one example that you could use for reference as your team creates their own aim statement. So this example aim statement says to increase the rate of assessment of orthostatic blood pressure from 25% to 75% over the next 6 months for all adult patients ages 65 and older who visit the clinic and screen positive for fall risk. To help us answer the second question, how will we know that a change is an improvement? We need to identify the data and the measures together to help us understand if the changes that we implement to try to address the problem or issue that we're hoping to address do in fact actually lead to improvement. Measures for improvement efforts often fall into one of three categories: outcome measures, process measures, and balancing measures. Outcome measures are the measures that we typically focus on or think about first. Almost all improvement activities will include at least one or more outcome measures. Outcome measures are those that help us indicate how the system is performing. So, the overall result or the impact on our patients, employees, or maybe even other stakeholders. An example outcome measure for an improvement project for assessment of orthostatic blood pressure is the percent of adult patients ages 65 and older who screened positive for fall risk with a completed assessment of orthostatic blood pressure documented in their medical record. Process measures are often logically connected with the outcome measures. So, with process measures, these measures will typically show improvement before we see improvement in the outcome measure. With this in mind, process measures often serve as an early indicator of whether or not our changes are improvements. Process measures help us understand if the parts or the steps in a system are performing as we planned or intended them to perform. So, an example process measure for an improvement project for assessment of orthostatic blood pressure is the percent of adult patients ages 65 and older who screened positive for fall risk and who were offered an assessment of orthostatic blood pressure. Process measures are very valuable measures as we work to test changes, and it can sometimes be easy to want to collect a lot of process measures. So we advise you to just think carefully about the measures that you really need to help you start to see if your changes may in fact be leading to some sort of improvement. Finally, we often look at balancing measures as part of our improvement work. So one way to think about balancing measures is that they can help us detect unintended consequences of the change that we made, whether that's for better or for worse. Or they can help us keep track of events that might serve as an alternative explanation for the improvement. So, in other words, we might see changes in our outcome, but perhaps they can be explained by something other than the change that we were intentionally testing or trying to make. So, an example of a balancing measure for an improvement project for assessment of orthostatic blood pressure might be the average length of a clinic visit for adult patients who are ages 65 and older. So, a proper assessment of orthostatic blood pressure can take some time, upwards of 10 minutes, even when it's done efficiently. So, being able to look at if there are any unintended consequences of implementing that type of assessment, such as extending clinic visits too long, or perhaps you might look at something like late starts or patient wait times for those older adult patients who are seen in the clinic. Those types of balancing measures can help us to see if there are some other unintended consequences or broader effects of this change on other aspects of our system. So, a couple of key things to keep in mind as you develop measures for your improvement efforts is to just make sure that you provide a clear name for the measure. Make sure that there's a clear operational definition for that measure, including a numerator and a denominator that makes sense for the measure. And to make sure that we're really clear about who's going to collect this data, where it will be collected from, and how often it will be collected. Finally, to help us answer the question, what change can we make that will result in improvement? We need to identify and select changes that we anticipate will help to address the problem and help us achieve our aim. So often the changes that we need to make for improvement are relatively clear and straightforward. So for example, in the context of assessing orthostatic blood pressure, perhaps you need to select a protocol to follow for this assessment. Maybe you want to change your protocol for this assessment. Perhaps you want to change when you conduct the assessment during the patient's appointment. Or maybe you want to focus on improving your patient education about assessing orthostatic blood pressure. So many of our improvement efforts are complex, and sometimes more than one change is going to be needed to help us address the problem. The concept called change concepts can be really helpful guides here. So a change concept is a general notion or approach to change that has been found to be useful in developing, or at least informing, the development of specific ideas for improvement. These categories can be helpful to think about as you formulate a specific change, as they can connect your change back to a broader concept that might guide the way that your team thinks about or tries to approach the change. So on this slide, I've highlighted several general change concepts here with some specific examples related to how this could be relevant for assessment of orthostatic blood pressure, in hopes that perhaps this might spark some specific ideas for your team to think about as you plan to begin to test some changes in your clinic. One is to focus on the service. So thinking about what improvements can you make to the design of the service. So some questions you could think about here might be what approaches to assess orthostatic blood pressure work well for your patient population? When might you offer this assessment? How do you inform patients about the process? A second change concept is around the idea of enhancing the patient relationship. So, thinking about how you can better understand and respond to patients' needs. So, in this case, you might think about questions like what are patients receptive to about assessing orthostatic blood pressure, or what might be necessary to overcome any resistance. A third change concept that may be relevant to this topic is the idea of managing time. So, how can you reduce or optimize the time that's spent on an organizational function? So for example, here we might think about a question such as how can you streamline your assessment of orthostatic blood pressure, knowing that the process can certainly take some time. A fourth relevant change concept is the idea of managing variation. So the broader question to think about here is how can you reduce the frequency of poor results? So as this is related to our assessment of orthostatic blood pressure, the question your team could think about is how could you standardize your processes to assess orthostatic blood pressure so that all eligible patients are receiving an accurate assessment of their orthostatic blood pressure. A fifth relevant change concept is the idea of improving workflow. So your team can reflect on a broader question of how can you change the workflow so that the process is planned and flows smoothly. So some more specific questions in relation to assessment of orthostatic blood pressure might be, when is it best in the patient's visit to complete the assessment of orthostatic blood pressure? How are we sharing these results with the medical staff who need to know those results? And when are your results documented into the electronic medical record? Finally, a sixth change concept that might be relevant to this topic of assessing orthostatic blood pressure is thinking about changes to the work environment. So the broader question to reflect upon here is what would make the environment better able to support improvement in this area? So a specific question related to assessment of orthostatic blood pressure that your team could reflect upon is thinking about what information or training or resources are needed in our clinic to help support changes to incorporate assessment of orthostatic blood pressure for our patients. So, in summary, the model for improvement can really help to guide your efforts to improve assessment of orthostatic blood pressure. A clear aim statement is a helpful guide, and it will guide your work and inform what success looks like for your team as your team works on their improvement efforts. Some clearly defined measures are very helpful to inform if you have achieved your aim, if you've made a difference, and what the impact of your changes might be. And then finally, to encourage you to think really carefully about the specific changes that you might want to test in order to improve efforts to assess orthostatic blood pressure. Finally, I'll leave you with links to several tools that you can download from the Institute for Healthcare Improvement to support your work in developing an aim statement, developing project measures, and to use change concepts to inform specific change ideas for your improvement efforts. To access these materials, you simply need to visit the link online. And then the Institute for Healthcare Improvement does ask for your name, your organization's name, and your email in order to download the materials for free.